Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Drugs used for angina. In the angina, we can use different types of drugs, like we can use nitrates, can be used, beta blockers can be used, calcium channel blockers are used, and we also have newer drugs. The newer drugs which are used in angina are dipyridamole, ranolazine is used, and ivabradine can be used with fasudil or trimetazidine are the new drugs which are used. Then we also have other drugs which can be used, especially coronary dilators are used. These coronary dilators are mainly the potassium channel openers, like we have nicorandil, then we have chromacalin or pinacidil can be used. So these are the different drugs which are used in the angina.
thank you and thank you for watching.